My name is Matt Ross. I'm from STI Computer Services. And we want to thank you for joining our informative program today on why you need business cyber insurance. In today's webinar, we'll touch upon regulatory exposure, the true costs of cyber attacks, how to best prevent an infiltration, and what you need to do should one happen. So just a couple of quick housekeeping items. Our program today is going to run about 30 minutes. All the attendees today are being placed on mute. However, you can submit questions you have in the question icon in the upper portion of the screen, and we'll go over those questions at the end of the program. Now, some brief information on our presenters today. John Salvucci is the principal of Fortside Insurance Group. He brings over 25 years of experience in the insurance industry. He specializes in advising healthcare practices and technology firms on cyber insurance strategies, as well as a full range of property and casualty coverages, including general liability, workers' compensation, property, and professional liability. His practical, client-focused approach and deep industry knowledge have made him a trusted advisor in businesses navigating today's increasingly complex risk landscapes. Now, Joe Serra is our marketing and sales manager here at STI Computer Services, where he has been helpful to medical practices optimizing their technologies, compliance, and operational efficiencies since 1991. With more than 5 decades of experience in healthcare software and information technology, Joe specializes in delivering solutions that strengthen cybersecurity, streamline workflows, and support long-term practice growth. Known for his deep industry knowledge and commitment to client success, he has become a trusted resource for practices seeking reliable guidance in the increasingly complex digital landscape. So let's get right into our program as I turn this over to Joe as he grounds us in today's environment. Joe, can you take this away for us?
Thank you, Matt. And thank everybody for attending today. Let's get to it. Data breaches are still on the rise. For the past several years, they've been getting more and more prevalent. But the last year, 2024, where information was recorded, there were over 184 million records actually breached through the United States. And today we're going to talk about what that means to both medical practices and small businesses. From a standpoint of data security, the government divides those two entities into separate categories. They both are required to handle OSHA, FTC rules, and the breach laws, especially by the state. But the medical practices have another requirement, and that's what's called the HIPAA security rule requirement. And HIPAA is a program that's been in force since President Clinton was in office that protects what they call PHI, or personal health information. So although all businesses have information for credit information, personal information, as well as financial information, medical practices also have health information, and that makes the liability even greater to a medical practice than it does to a small business. The consequences to data breaches is becoming more and more expensive, and at the end of this, we'll go through some of those numbers and give you an idea how much liability you have by having a data breach. And then we'll have John come in and talk a little bit about cyber insurance as a way to reduce your risk. From a HIPAA standpoint, currently the federal government has a new HIPAA rule, and they've overhauled the old HIPAA requirements. What they're finding is the average cost of a data breach to a healthcare organization is over $7.4 million. And the large organizations, talking about ambulatory surgical centers, hospitals, have gone over 710 breaches since they started counting these. So what's the true cost of a cyber attack? When a medical practice or a small business is attacked by a ransomware type situation, or someone trying to breach the data within that organization, there are several types of costs you have to look at. The first one is a direct financial cost, the cost of repairing the breach, paying for credit reporting to the organizations that have been hit, as well as restoring your data into your system. There's also an indirect impact, and that concerns trust by your clients and your patients. And also, you've got the problem with lawsuits. And we're finding that a lot of organizations that have been breached not only have to cover that cost of security to get their data back up and running, but they also are facing client lawsuits for the breach. So what really happens when you have a ransomware attack? And a lot of folks don't understand this process, but the way it all works is if someone gets into your system, either through someone letting them in accidentally or a software hole that they can get into, the first thing they typically do is start copying information off your system. What they do is destroy all of your backup information so you cannot restore. And finally, what they do is they encrypt your data and send you a demand for a ransomware payment, typically in Bitcoin. So what happens to a medical practice or a small business is all of a sudden your operations completely stop. And the reason is you have no information. When you go into your computer, everything is blank. You don't have your patient information. You don't have financial information. You don't have appointment scheduling. Everything is completely stopped. A bigger problem for healthcare organizations is patient care stops. While a non-health organization can still see customers, a healthcare organization cannot, because all of their medical records and their financial records are in the computer, and they cannot see a patient without a medical chart because they have no idea what their conditions are. Next, there's a revenue loss, typically between $100,000 and $250,000 while systems are down, trying to get that system back up. And then there's fines and reporting requirements. HIPAA requires a medical practice to notify all of their patients, which becomes a big problem without data. So typically what they're being forced to do is put a notice on their website that they've under a HIPAA violation and under a ransomware attack, and they'd have to call the practice to get more information. And there's actually a survival risk. Quite a few businesses don't make it through a ransomware attack. Here are some numbers just to give you an idea of what the costs are. These are actual practices that have been hit by a ransomware attack. We'll just pick one. Let's take that one in Georgia, small medical practice. The ransom was $50,000. The downtime was $250,000 to get back up. They had $500,000 in lawsuits. They had premature closure, for the reputation was completely destroyed, and employee turnover obviously was very high. But it's not just medical practices. This is the impact of a ransomware attack on a law firm. This gets very expensive. The biggest reason is law firms often face class action suits by clients. If you think about it, if all of their data has been destroyed, they don't have the ability to go to court. So if they've got court cases scheduled during a ransomware attack, they cannot even go to court and defend a client. And they seem to have the most lawsuits coming back at them from their clients. The other organization that faces problems are accounting firms. Accounting firms also have fiduciary responsibility for their clients' financial information. They can't do, obviously, quarterly reports. They can't do personal income tax. All that information is been destroyed. And I will tell you from a fact, even if a practice pays the ransom, there's no guarantee you're going to get your data back. So let's just decide that we don't want to face a ransomware attack or a data breach. It's just not worth it. So what do we have to do to avoid that? Well, the first thing, obviously, is regulatory compliance. You must be sure that you are compliant with the laws that exist to protect patient data, right? You also need IT support. Everybody should have what we call the managed service organization. In the old days when we had servers and the information was self-contained within a business or a medical practice, it was pretty much okay to handle that yourself. But now that we're on the cloud, you have other risks associated with your data being in another place. For instance, it's just not you that can have a ransomware attack or have a data breach, but the person hosting your data can also have that danger. So you have two places where you can be in trouble. One, locally, if one of your staff members lets someone in, and more importantly, in your software in the cloud, if your vendor has an attack. So the first thing you want to be sure is that your MSP, that's the company that has your data, has been making local backups for you. So if the data is destroyed at the server place in the cloud, you still have a copy of your data locally so that if you don't pay the ransomware, you can get your data back. And the final thing we want to talk about is insurance readiness. The cost of all of this, and John will get to this later, can be minimized if you have a cyber insurance policy that protects you if you have a data breach and pays for a lot of these recovery operations and fines. What we do at STI is what we call the four-legged stool. We look at cyber security in four particular ways to protect a business or a medical practice. The first place, if you're a medical practice, and this only applies to the medical people, is a security risk assessment, which is required by law by HIPAA. Every medical practice has to have a written security rule analysis done prior to a ransomware attack. If they don't have that, there's actually additional fines. You go from a poor person that had a data breach to being negligent because you didn't prepare properly. Although small businesses don't have to have a risk assessment, it's probably a good idea to do that to protect yourself, to show if you have an attack that you did everything possible to avoid it. The second thing you need is a managed services IT monitoring and cybersecurity. That's what STI does. We maintain your data and make sure that it's being updated, that you're doing patch management, and that all of your data is up to date and being stored off-site somewhere else in case there is something like a ransomware attack. A data breach is a different thing. That involves that you let data get out. You still have your data, but you have to probably contact your clients, let them know that happened. Third thing you need is compliance and staff training. It's been shown that most of the breaches come because someone within the practice lets the bad guys, if you will, into the practice by a phishing message or clicking on a email link that lets someone get into their system. And once they're in, they can do a lot of damage. And the final thing that we want to talk about is cyber insurance. I'm going to turn this over to John and come back in a minute and talk about the the exact costs of recovering. But before I do, I wanted to show you one thing. These are actual cases of practices in Eastern Northeast that have had a ransomware attack. And if you look in red, you're seeing risk analysis failure, HIPAA risk analysis violation. The first thing that the federal government does when a medical practice has a ransomware attack or a data breach is they want to see your written risk analysis. And typically, this is where the majority of the fines come in for a data breach. It's the lack of having that risk analysis report. Let me now turn us over to John Salvucci from Fortside Insurance, and we'll spend some time on going through cyber insurance and how that protects your practice. It's all yours, John.
Thanks, Joe, and thanks to everybody for being on the call today. My firm specializes in cyber insurance. We work a lot with healthcare organizations as well as tech firms. And because of our specialization, we spend a lot of time speaking to cybersecurity experts at both insurance companies and elsewhere in the private sector and public sector. And I can tell you, the more I personally learn about the world of hackers out there, the more scared I get. These are professional organizations. People wake up in the morning, they get dressed for work, they take the bus to an office building, and they hack from 9 to 5, and then they go home and eat dinner with their family. We need to match their professionalism, and we do that by partnering with MSPs such as STI, and we need to secure our businesses with cyber insurance. We need to transfer that risk to insurance companies in order to protect our businesses. A lot of the businesses that we work with are not major corporations. And a lot of people think that only Citigroup and JP Morgan are the targets of hackers. The reality is that these bad actors seek out the path of least resistance. And typically, that is a small business that does not have the security in place that Citigroup might. They look for the easy hits. And oftentimes, small businesses are the perfect target, especially if you're a healthcare practice. We'll get to that in the next slide. But I just want to, we can look at that now. If you are a healthcare practice, just know that you have the most valuable data that a hacker needs. You're in a highly regulated industry. You're typically working with multiple systems patched together, so there's multiple points of entry for a hacker. And I would just encourage you, do not be the easy target. We do a lot of camping as a family, and I tell my family, if a bear shows up, we don't need to outrun the bear, we just need to outrun the other campers or the other hikers. And that's the mentality that all of us should have. We need to be slightly more difficult, hopefully much more difficult, but certainly more difficult than the other targets out there. And you do that by taking some very basic, implementing some very basic security in your business. Joe, let's jump to the next slide. Joe spent some time talking about breaches and the cost of breaches. As you'll see here, this is a relatively small breach, $200,000. It's hard to think of small businesses incurring a $200,000 claim and kind of coming out of that. I know a lot of small businesses that I work with could not. So you'll see here, these bullet points represent the different areas that add up to this total cost. There's a number of different costs associated with each one of these bullets. And if you don't have cyber insurance, you're going to have to kind of put this team together yourself. And in many of the businesses we work with, they simply don't have those types of professionals or people with that know-how in-house. So you have to go out and get that. If you don't have cyber insurance, you're going to have to do that on your own. If you don't have an MSP, you're going to certainly have to do that on your own. So what I tell clients is that by buying a cyber insurance policy, you're essentially purchasing a response plan, because as soon as you buy the policy, it's the insurance company's dollar that's on the line, and they don't want to waste their money. So what they're going to do is they already have the team built to react to a cyber claim. So the call that you make after a claim is certainly to your MSP and then immediately to your insurance carrier, because they're going to put the team together for you, which is a skill set that many of us don't naturally have, and we certainly don't practice. Joe, let's jump to the next slide. I just want to demystify the difficulty of getting cyber insurance. It takes a matter of, it could happen in a day. You could have a quote back within a day. This is not necessarily a complex process. All you need to do is you need to have the right resources available to you. There are going to be some questions, and we'll get to them on the next slide. But for the moment, I just want to state that there are going to be some questions related to your cybersecurity. Other than that, you're going to know, whoever's running point on this cyber insurance placement is likely going to know how to complete the rest of the application. The applications are typically 1 to 2 pages. They ask very basic information about your business, such as the number of employees, the revenue, and then they get into some security questions. If you have an MSP, such as STI, or if you have someone within your operation that understands the security in place, you can simply go to that person and get these questions answered. Once the application is complete, you're 99% done of anything you need to do. Your broker will then go to insurance carriers and come back to you with quotes and recommendations, and you'll just need somebody, a stakeholder or leadership within your organization to commit to move forward. But like I said, this can happen in 1 to 2 days. You can have quotes back. Joe, let's jump to the next slide. These are examples of security protocols that underwriters like to see. If you don't have one of these, you could still get insurance, but it will impact your premium, and sometimes it'll impact the type of the limits that you could purchase, or even the coverage available on your quote. Again, hackers look for the path of least resistance. If you can put up these blocks within your organization, you are ahead of the game. Let's jump to the next slide. This is an example of the questions set on a typical application related to cyber controls. You'll see here they don't ask for a narrative or an explanation of how you operate. These are yes/no questions. Do you have antivirus or firewalls? Do you have encryption in place? Do you have backup on the cloud? Do you have multi-factor authentication? You'll see questions 7 and 8 right now are listed as unknown. I was able to get quotes for this client even without MFA confirmed. So these questions don't all have to be yes. Certainly the more yeses here, the better position you'll be in. Let's jump to the next slide. I just want to take a couple minutes to talk through the types of coverages you can expect on a cyber policy. And I want to break it down into first-party coverage and third-party coverage. First-party coverage is that coverage that will be provided on your policy that covers the expenses your organization will need to incur to resolve a cyber claim. You'll see here there's a cyber incident response team. That's the team that the insurance carrier will bring to the table for you. And they will pay that team, in this case, up to $1 million for the services that they provide. There's also business interruption coverage. As Joe mentioned, when there's an attack on your business, I equate it to just getting very sick with the flu. You go through your day, you have a million things you need to get done, but when you get the flu, nothing else matters. You lay in bed and you realize that the only thing that matters is your health. And that is how these claims impact businesses. They're doing a million things right up until the attack. And then all of a sudden, it's the only thing that matters. So business interruption will cover that lost profit that you incur while the business is getting back on its feet. There's even contingent business interruption. Your vendor, your key vendor, your software provider might have an attack that shuts down your business. So contingent business interruption means the interruption doesn't happen at your business, but it happens at a business that you're reliant upon. So you'll see how broad these policies are. For the sake of time, Joe, let's jump to the next slide. There are some crime coverages included. These are particularly precarious, and a lot of insurance carriers actually do not include these types of policies or these types of coverages on a cyber policy unless you ask for them or seek them out. And you'll see their limits are lower than limits of some of the other coverages. These are examples in which someone actually pretends to be someone else and tricks someone at your organization to send money to an account that does not actually exist. We've seen hackers kind of live within an email network, pretend to listen to conversations, understand that a key manager is out on vacation, and then send an email that looks like it's coming from that manager, instructing a junior employee to send money somewhere because they're on vacation at the time. So they're sophisticated, and a good cyber policy will respond to that. Joe, let's jump to the next slide. Then, of course, there's third-party cyber coverage. These coverages are intended to cover lawsuits that come in from your customers, vendors, or third parties that are suing you for financial loss as a result of the data breach. These can get very expensive depending on the data that's lost, and this type of coverage is included in a standard proposal. Joe, next slide. So again, just so you have a plan for after this call, first contact an insurance broker. If you have an existing broker, they should be able to help. If you need a broker, we are happy to help. Complete an application, work with your managed service provider or your broker or someone within your organization that can help guide you to answer those security questions. And then the next step is easy. It's just wait for quotes to come back and bind the coverage. These policies are not particularly expensive relative to the limits that they provide. We deal with small healthcare practices where premiums are between $2,000 and $4,000 that provide $1 million of coverage. It all depends on the size of the organization and the security protocols that are in place. Joe, I'm going to turn it back to you now.
Thank you, John. It's very helpful. Let's talk a little bit about what the cost of all of this means. I always like to have someone give me some ballpark numbers so I know what we're talking about, and I want to do that for you. So let's look at a fully loaded, in this case, a medical practice, and compare the cost of having cyber protection versus the cost of a PHI breach or ransomware risk. I like talking about numbers so they're scalable as a percentage of employee cost. Every owner of a business knows that when you pay a salary to someone, that's not the total cost of that person. What you have to look at is the cost of taxes, benefits, workman's comp, all of that. So typically, to bring a new employee into a medical practice or a small business, you're looking at 138% of the salary cost. So if the employee's costing you $100,000, you're looking at another 38% above that cost for his benefits. So let's look at an MSP, which is someone that's going to support your software organization. I know a lot of small medical practices have an MSP, or a lot of them don't. They've got maybe someone that knows computers. The cost of that professional assistance is about 6% of the salary cost of that employee. It's not a lot to add an MSP to your organization, so you've got professional coverage and good protection. Cyber insurance, about 2% of the salary cost. Now, obviously, these are general numbers. They're not exactly what they're going to be, but just give you a ballpark idea. And then you've got your IT equipment, your compliance training, all of those things that belong in that four legs of the stool, another 7%. So the cost of protecting your business fully or your medical practice is actually 1.53% of your salary. So it's not a real lot of additional cost to protect the practice or the medical or the small business from becoming a victim to a data breach or a cyber attack. Compare that with the two major costs, one being a data breach, which could be anywhere from $1.8 to $3 million, or a ransomware event and a cyber attack data breach, which doubles the number. So now you got 1.8 plus 1.5. So you're looking at a proportional number, right? It's 1 to 20 as a relationship. So this is an example of a pretty medium-sized medical practice that has 5 providers, 2 physicians, 1 nurse practitioner, 2 full-time nurses, 7 clerical staff, a business manager. The complete investment for those 4 legs of the stool probably costs that large medical practice about $108,000 per year. Obviously, a smaller practice will be less, a larger practice will be more. But what are they avoiding? They're avoiding that data breach cost and a ransomware cost. So you're looking at a relationship of the cost 1 to 20, 1 to 35, which basically protects the business from those costs. So how do you go about finding out what your exact costs are? STI does evaluations for businesses and medical practices to give you an idea of what, if you're protected, and what type of additional help you need. A comprehensive IT assessment typically takes us between 8 and 16 hours of interviews with the medical practice or the small business, and some time to write up a plan after it's over of what you need. So we evaluate all 4 legs. If you have an MSP, we're evaluating if they're healthcare specific or if they have experience with handling cyber attacks. We also take a look at network management, your architecture. We look at regulatory and insurance alignment, as well as reporting and value. So we go through that whole process. And what we use for our model, if you will, is a complete IT MSP, cyber risk reduction, in all 4 legs of the stool. So we're looking at your security risk assessment. Do you have one? Is it up to date? We look at managed services from STI or your current MSP to see if they have all the things in place that you need to protect your medical practice. And we also look at compliance and staff training. One of the most important things you can do is train your staff not to fall for a cyber attack. And then again, also cyber insurance. We'll work either with your broker, or if you don't have one, we'll be happy to encourage John to talk to you about the cost of cyber insurance. STI is not an insurance agent. All right. So we go through this proactive security action. We look at reducing the chances of having a breach. We look at safeguards and ongoing documentation. Obviously looking at getting your data off site. So if you are attacked, you got your data somewhere else besides on the cloud or in your server. And there's a cost typically of this for those 16 hours of about $2,400. We're having a promotion during April and May, and we'll do a complete IT assessment of your small business or medical practice for $800 as an effort to give you some idea of what STI can do to help protect your business or medical practice. And the plan is completely tailored for continuous improvement for your practice. So let me now go to questions. Do we have any questions, Matt?
Well, hey, Joe, John. Yeah, I actually got a couple that came through. One of them, John, I think this is for you, is what happens if I answer a cyber application incorrectly or falsely, and then I have an attack?
Okay. You certainly want to try to get out in front of that and answer the applications correctly. A lot of underwriters rely on the applications in order to provide quotes. It will depend on the answer that's given, and to determine whether or not the coverage will, whether the insurance carrier will cover it. I would be surprised as long as the answer was given in good faith. I think the insurance company would have a difficult time declining. But what I would recommend is, while completing the application, talk to your MSP. There are many times when I work with clients where they may not have all the protection in place at the point of time of the application, but they're on their way to getting there. And within 2 months, they have more security. So we've worked with underwriters where they allow us to bind coverage with a certain with a certain limit. And then as additional security is added, we're able to increase limits or broaden coverage. And typically that also results in lowered premium. So I would encourage you to speak to your IT vendors, your MSPs before completing the application, because that application is going to require a signature, and that person signing wants to make sure that the application obviously is correct. So err on the safe side when completing applications, and then we can always update them throughout the policy term.
Okay. I think I've got another one here, and it states, I heard of patch management and endpoint detection and response. What exactly is this? Joe, I can probably jump in, I guess, on this one. So just kind of in quick summary, patch management is really keeping all of your systems and your software up to date. That can include operating systems, different applications, software infrastructure. Think of like your phone even, as to you getting notified of a new update. Those updates help keep your systems free, at least as free as can be, of some of the dangers that can come around. So when Windows 10 to 11 is a good example, making sure that all of your systems and all of your computers are up to date so that there's not a vulnerability of potential or a hole. I think Joe mentioned that earlier. And endpoint detection is really the cybersecurity solution that's continually monitoring your end user devices, like your laptops, servers, mobile devices. It's all in real time. It helps investigate and remediate any advanced threats that might be coming into your systems. Endpoint is a part into this whole, it's a critical component of what the disaster recovery and the responsiveness is by making sure all that your systems are up to date and being managed correctly. So I think those are the questions, Joe, that I've got for now. If you just want to provide some information on how to get a hold of us.
Okay, thank you. One last thought, I will tell you this. You do not want to have a data breach or become a victim of a ransomware attack. And John's analogy is a very good one. You don't want to be the slowest runner when the bear is chasing you. You really want them to go somewhere else. And the best way you can avoid this is by having your system wrapped up tight so they can go somewhere else. So I think it's worth your time to have us look at your IT situation. Thank you for attending. Our next webinar will be on May 20th, and that's for medical practice. And we're going to go with the new HIPAA security rule, talking about what's in it, the new SRA rule, and how it protects your practice. If you'd like to contact Matt or John or myself, our phone numbers are here as well as our email addresses. And we're going to leave this up for a few minutes as we sign off. But I want to thank everybody for attending today. We ran a little bit long, but not too bad. And thank you. We'll be in contact, and we'll have someone give you a call and see if you have any questions.
And Joe,
thank you for your time.
Joe,
Yep.
just to add, we have had a few extra questions come through. Just let
Yep.
those individuals, just want to let everyone know, we will respond to those people and give everybody those answers.
Okay, that's great.
Thank you.